Welcome, friends. This is Dr. Jaitly, your cardiologist, on your favorite video channel, which is being shown on social platforms, MuniMeterHealth, primarily dedicated to enhance medical education and patient education, as you know, and of course, the result is improved clinical outcomes, which have been clearly shown, and this has been my deepest belief in my 40 years of my practice here, that if you combine the two, certainly you can improve your clinical outcomes tremendously in all your and that the patients will have a better adherence for their prescriptions, for their follow-ups, for their diagnostic tests that have been advised, and of course, going back and seeing their physicians more often as required. And needless to say, the compliance is just huge at that point, almost nearly 100% once you combine the patient education and medical education. But for patient education, you really need to get to the bottom of the illness in very simplest terms. So that's what we're going to try and do in this video vignette also. Thank you for associating on MuniMeterHealth, your favorite video site. Now, without any further ado, I'd like to say, how does Holter play a role in the cardiac exam, if you will? Okay, so it's very, very important. So let's understand what Holter is first. Well, Holter is it's an exam where a continuous ECG is being offered. Now, you could do a continuous ECG for, say, several hours, but normally it's for 24 hours. Many times it could be for 48 hours, or it could be even 72 hours. And there are times when actually you require the person to have it worn for 30 days. Now, that may be a little too much, but many times even that's also done, because if the yield is extremely rare on within this period, then obviously you have to allow the person to know exactly how to place it on. So now, so it's basically a continuous ECG monitoring. Now, you know ECG has 12 leads, so you're not going to plant 12 leads in a Holter. What you do is you apply about mostly 3 leads or sometimes 2 leads, and so it's a 2-lead continuous EKG or 3-lead monitoring. Just like perhaps if it's almost like a telemetry monitoring now, where you could actually monitor the person also while the patient is wearing it remotely, and of course many times they come back and return it back the next day, and then you can quickly analyze and scan it. So without any further ado, let's understand how the Holter is being placed in. We're going to draw a small schematic here, and we'll give it a try and see how that works with this new workboard. Okay, here we are, and we're going to draw the chest, and this is the abdomen, and then of course the arms are here, and I'll show the biceps here a little bit in this individual, and then of course the shoulders, and then the clavicle. Okay, so that worked good. Now let's understand here, this being the sternum of the individual. And so the leads are kind of placed in this fashion. Let me draw with a different color. So you'll have one lead placed here, for instance. Another lead will be placed here. Another lead will be placed here, being the left side. And another lead being placed here, right below the left nipple or left axillary line, if you will. And then it'll be, and there'll be another lead placed here, which will be your earthing, so the right lead or whatever. So that is. So these are the 5 leads where the person could be connected to, and obviously these leads will be, here, as you see, they're all being connected, and they'll all eventually go into a small little console, and that console could be attached, and it has a little dial in it. It'll tell you about the time. It'll tell you, normally it's battery operated. Sometimes it's rechargeable battery, so you don't have to worry about it. Now it's all digital. In good old years, I should say, we used to have typical cassettes, but now it's all simple digital chips. And so the next day, when the person returns it back, then automatically it is analyzed on a computer. Now the console is clearly showing basically the ECG patterns, and there'll be 3 leads EKG, which will be printed off or could be scanned. And essentially what's being done is what's being done is really to assess if they're what the heart rate of the person has been. The lowest heart rate, say, for 70, as opposed to 120, which was, say, the highest while he or she was climbing the stairs or running for a train or a bus in the morning. 70 could be, say, just about when he or she is resting. Likewise, you would like to see what VPCs were present, like extra premature beats that are rising from the bottom chamber. Now, let's draw the heart for a second here, which is my favorite schematic right here. And as you see, there are two chambers on the top and two chambers at the bottom. So this being the right atrium, left atrium, right ventricle, and left ventricle. Now, if the bottom chambers, when they, so the VPCs will arise from here, okay, and APCs will arise from here, and they could be all discerned on this EKGs here. So VPCs could be counted in terms of number per hour, and you could see if there are any couplets, like if they're occurring in repetitive, sometimes triplets could be present, etc. And same thing will apply for the APCs as well. APCs stands for atrial premature contractions and ventricular premature contractions in case of VPCs. So per hour is very important to know how many have occurred per hour, and then you look at it in 24 hours, how many are there, etc., etc. So couplets could be seen here, triplets could be seen here, runs could be present. Sometimes you could see bigeminies. That means, again, alternate beat are abnormal. In other words, you would have a normal beat, and then you'll have an APC, a normal beat, and then you'll have a VPC here and a V. So having said that, then you could see the blocks. Is the heart slowing down? Are there any blocks or missed beats, rather, we call them? Are there any missed beats? That means the patient dropped some beats during the course of the 24-hour analysis. Likewise, you could also see some runs. Were there any runs that were present, like ventricular tachycardia or atrial tachycardias or supraventricular tachycardias? Now, these are various terms. I'm just throwing them here so that this way, of course, I've done separate videos and individually on each one of them, so you could always wide in those and learn more about it. But the very fact that you could also see all these runs of tachycardia. So you could see the slowing of the heart in the form of blocks, and understand what kind of blocks were there, etc., etc. Sometimes it's a first degree AV block, it could be a second degree AV block, it could be a third degree AV block, and all these second and third degree obviously speaks of more significance. First degree AV block normally is not, but could just reflect. So, the whole analysis is very important. Why is it done? Well, it's very commonly done primarily to assess for patients who have arrhythmias. So one, you would like to know if these patients have any arrhythmias. Patients have any palpitations, which could be related to any arrhythmias. So arrhythmias, palpitations, patients who are dizzy, sometimes they complain of dizziness. Sometimes they may complain of chest pain. Or breathing difficulty, we call it shortness of breath. And then there are times when patients may have passed out. So these are very common indications where you could do them. They could be analyzed after an MI. So an acute MI has occurred and these patients are not discharged, etc. Sometimes pre-discharge, you could do a Holter to assess if there was an arrhythmia. Heart failure patients, they frequently have ventricular arrhythmia, especially the left ventricle here is enlarged. So all these are indications where one could actually assess the cardiac status, if you will, by a Holter examination. A very simple 24-hour ECG, obviously no radiations, no injections, no needles involved, a simple 5-lead EKG or maybe 3-lead EKG many times attached to your console. You go home, bring it back the next day. And that's basically it. The instructions, of course, the technician or the cardiologist at the office will be able to give it to you, and it'll be done as an outpatient. The whole key is that you want to really have a good representation of your 24-hour sample of your life. So be sure that you're not laying in bed and sitting on a couch all day with this monitor and worrying about it. Most people actually forget about it in 10 seconds after it's being placed on, and next thing is they're saying goodbye and see you tomorrow to the physician, and they go about their business. You can go shopping, you can go running, the only thing you can do is a shower for 24 hours. So I always tell the patients to shower before you come, so the next day morning when they return it back and they can jump into the shower soon after. So once the leads are are off. Many times I can also ask the patients to remove the leads. It's very simple. All you have to do is just peel these off and roll it up in a bag and bring it back to the physician the same evening and return it back. So that also can be done. So this way the patients are not inconvenienced that they have to come in the morning and return it. They can do it at the end of the day after their work. So it's a very, very convenient test, and we like to make it very convenient for the physician, for the patients as well. And again, the whole dearth of information, as you see, for all these symptoms that we just talked about could be analyzed here. Remember also to look for the treatment efficacy. Now, many of these patients, they could be on certain medications, especially the beta blockers or the calcium blockers, and they obviously slow down the heart rate. So you're looking at various medications that could slow down the heart rate. So are there any blocks that are occurring? Are there any runs that are still occurring because you're trying to control the runs? Say SVT was being controlled by a beta blocker or calcium blocker. Are there still any runs present? So there's an efficacy of the drug that could be analyzed as well. But again, these are short videos, so this way you have a grasp as to what Holter is all about, and essentially you understood how it's being placed on, and what are you analyzing, and what are the indications here, as I just enumerated them under this heading. Okay, thank you again for watching, and I want you to be associated with MuniMeterHealth. Again, please press the like button if you liked it. I always say that, but do suggest, comment, and question, and we try to answer those questions and comments within 24 hours as much as possible. We are getting busier, obviously, but my gut feeling is always to try and answer within the 24 hours period if I can. Okay, and again, thank you for associating MuniMeterHealth, and again, continue to propagate medical education, patient education to improve the clinical outcomes, please. And so long, and until the next video, this is Dr. Jaitly.